Hi, this is Carrie from Easy Immune Health. Today we're going to talk about magnesium and heart disease with two studies that examine the association between magnesium levels and sudden cardiac death. This first one, from the Harvard Nurses Study, published in 2011, showed that despite promising autopsy and ecologic data supporting a specific association with magnesium and cardiac death, to their knowledge, only one other study had examined this association. This leads us to the next study from 2010, the Atherosclerosis Risk in Community study that covered a multi-ethnic population of thousands of men and women, which showed that high blood levels of magnesium were associated with an almost 40% reduced risk of sudden cardiac death. This next study, a study done on women, showed that in a large group of women, the higher the magnesium levels, the reduced risk of cardiac disease. The women with the lowest magnesium levels had the highest risk of cardiac disease, giving the lowest risk people a 77% lower risk of sudden cardiac death. That's pretty impressive. Another 2011 study noted that magnesium is an essential mineral that's found in whole grains, leafy green vegetables, legumes, beans, peas, lentils, soy, nuts, as well as seeds. Acts as a cofactor in hundreds of enzymatic reactions in the human body. A considerable body of evidence indicates that a higher intake of dietary magnesium may favorably affect a cluster of metabolic and inflammatory disorders, including many of our top killers, like diabetes and heart disease. So, in this study, did they put a whole bunch of people on whole grains, beans, greens, and nuts? Of course not. They gave them a pill. That's the way studies are done. In this randomized double-blind controlled crossover trial, which is the best kind of trial, indeed, magnesium pills did improve some biomarkers in the bodies of the overweight individuals. But come on, even a Harvard Nurses study threw up their hands in defeat since most Americans do not meet the RDA of magnesium, even taking pills. And therefore, they decided that we need to take more pills and put it in the water and start fortifying foods. I mean, there's no way apparently that Americans are going to start eating spinach or something. It's true though, most Americans eat so poorly, they don't even get the measly recommended daily intake. In other words, the daily value for magnesium, which is 400 milligrams. This is how much the average American gets, about 300 milligrams. Well, we'd think that vegetarians get more. And how much do you think the average American vegetarian gets? Well, recently published in the Journal of American Dietetics Association, a vegetarian dietary pattern as a nutrient-dense approach to weight management, they measured vegetarian magnesium intake, and they're not eating their greens either. Non-vegetarians ate an average of 0.1, only 0.1 cups of dark green leafy vegetables a day. The vegetarians weren't much better. They ate only 0.15 cups of green leafy vegetables a day. They did better, but still not enough greens, beans, whole grains, and seeds. It's not enough to eat a plant-based diet. We need to eat a healthy plant-based diet. Thank you. This is Carrie from Easy Immune Health. Thanks for watching.